Shall we start, ma'am? Hello, Dr. Mohite, ma'am. Shall we start?
Yes.
Yes. Thank you, ma'am. First of all, very good afternoon. Namaste, one and all. Myself, Dr. Poonam Vajpayee, would like to welcome our respected dignitaries, respected governing body members, respected Gurujans, our today's guest speaker, Professor Dr. Swati Mohite, ma'am, all the scholar students and social media live viewers. I welcome you all in today's 112th session in this weekly webinar series Gyan Ganga, a knowledge voice. Now, before commencing this session, I also would like to pay sincere gratitude and pranam to our mentors, respected Padma Bhushan Shri Devendra Trigunaji, President of Governing Body REV, respected Vaidyashi Manoj Neseji, Advisor Ayurveda Ministry of Ayush, respected Vaidyashi Kaustubh Upadhyayji, Advisor Ayurveda Ministry of Ayush and Director of REV, for extending their great blessings, motivation and valuable cooperation for such endeavors, and their inspiration catalyzes our all efforts. Now today in this session, we have with us respected Professor Dr. Swati Mohite ma'am from Bharati Vidyapeeth College of Ayurveda, Pune, and she has got expertise in great expertise in Sri Rog and Prasuti Tantra with more than 28 years of clinical experience in treating gynec disorders. And today she is going to enlighten us on a topic: potential Ayurveda intervention in PCOS. Post session, there will be question and answer session. You can ask the queries at that time. Now, with the brief introduction of Dr. Mohite ma'am, we will start the session. Ma'am is presently serving as head of Prasuti Tantra and Sri Rog Department at Bharati Vidyapeeth College of Ayurveda, Pune, Maharashtra. She is MS in Gyneops and BA in Sanskrit, D.Pharm, and she possesses 20 years of clinical and more 28 years of academic experience as well, and is currently working on ICMR research project. Now, ma'am has been conferred with various prestigious awards like Dhanvantari Award for contribution in the field of Ayurveda for 25 years and Best Teacher Award, Samman Puraskar, and received Best Research Paper Award as well. She has undertaken clinical trials for pharmaceutical companies like Phytopharma Private Limited, Baidyanath, Ayurved Aushadhalaya, and published research papers in various national and international journals. She has presented research papers in International Ayurveda Conference, Netherlands, APNA, USA, Saurati Udupi World Ayurveda Conference, Jaipur. She has delivered speeches on various topics in national and international conferences, CMEs for teachers and practitioners. Till now, she has guided more than 15 PG students and served as subject expert for syllabus reformation organized by CCIM. She is chairperson of NABH Board of Faculty nominated expert for homeopathy faculty. She is also chairman of Grievance Redressal Committee and Prevention of Sexual Harassment Cell, Internal Quality Assurance Cell Coordinator, and she has published articles on topics like Shatavari in womanhood, Dashmularisht in cervicitis, and graceful aging, and is actively involved in various social activities. Now, I would like to request Dr. Swati Mohite ma'am to please start with her deliberation. Over to you, ma'am, and welcome. I'll share the slides. Yes, ma'am. You can proceed, ma'am.
Yes. Thank you, Doctor, for my brief introduction. Even I would like to thank Shikha to considering me to deliver a lecture in your institute. And actually, I prepared this PPT before for the postgraduate student, but now I have modified slides to make it easy undergraduate students also. Without taking time, I my presentation. My today's topic is Ayurvedic interventions in PCOS. It is experience. For last 28 to 30 years, I am practicing Ayurveda, and this presentation is based on my clinical. So next slide. Slide.
Yes, ma'am. I have changed.
There is lag, I think, in front of me.
Yes, due to network issue, ma'am. It may take few seconds. Please continue, ma'am. Yeah.
Yes. The next slide is actually for us doctors, because if it is a very Hungarian proverb. This is that time and patience are the three great physicians. We need patience with the time and a natural when you are treating any polycystic condition.
Excuse me, ma'am. Your
Not
voice is
patient
breaking.
patience, but
Excuse me, ma'am. Your voice is breaking.
okay. The state is good here.
Hello, ma'am.
Is it audible now? Is it clear now?
Yeah, your voice is breaking, ma'am, due to network issue, I think. Please sit at some place where there is network.
Hello.
Your network is wait again.
Hello. Hello.
Can you now?
Dr. Mohite, ma'am. This is breaking, ma'am. Please sit at a place where there is a connectivity. Yeah. All are requested to please stay connected. There
Please.
might be a technical issue.
Oh, this network is network issue येतोय.
Excuse me, ma'am. You can join with your phone also. Yeah, you can join with your phone also, ma'am.
छत्री गेले
Excuse me, मैम मैम आप अपना वीडियो ऑफ कर लेंगे तो शायद कनेक्टिविटी बेटर मिले. आप वीडियो ऑफ कर सकते हैं. Hello. Hello. All are requested to please stay connected. Dr. Mohite, ma'am.
Sorry for inconvenience. There is some technical issue. Please stay with us.
Okay.
Hello, Dr. Mohite ma'am, are you there? Hello, hello.
Yes, I am there. I am
Yeah,
there.
yeah, please continue, ma'am. Yeah. Now, okay.
आणि 28 25 मला वाटतं. आता असा इन्व्हेस्ट मला कधीच नाही सापडत. मायक्रोसॉफ्ट टीम वरून जा ना वरती.
मैम वीडियो ऑफ ही रखिए तो अच्छा नेटवर्क ठीक रहेगा, है ना? आप वीडियो ऑफ ही रखिए. यू कैन
ठीक आहे, ठीक.
हाँ मैम.
हा व्हिडिओ कर. काय झालं? मगाशी झालं तर आता काय झालं?
Hello. Hello, ma'am.
हॅलो हॅलो.
Yeah, please continue, ma'am. There is no need to switch on the video. You can use mic as well.
Now am I audible?
Yes, yes. Now audible, ma'am. Please
Yes.
continue.
So this is a very famous Bulgarian proverb where nature, time, and patience, all three things are very much important and required to treat any PCOS case. So nature means natural means Rutu also is important. Even atmosphere is also important whenever you treating a PCOS case. Obese case you are treating in the winter will take more time to treat the case. So this is very important to listen to remember that these are the three great physicians. These three qualities we must adapt to treat a PCOS case. Next. Now we will discuss what is the process of PCOS, how we will interpret PCOS, because polycystic ovarian disease or polycystic ovarian syndrome or polycystic ovaries, we are not getting direct similar disease in our text. Only few references it is mentioned, but not direct disease we get it. So we will try to interpret in our dosha dhatu mala siddhanta what is the pathogenesis, how the disease gets progressed, what are the diagnostic criteria, and what are the interventions that could be possible to treat PCOS, because till date there is no specific treatment for PCOS or complete cure of PCOS. PCOS is a condition if the ovary has tendency to produce immature or to liberate immature eggs on the surface of the ovary, then the tendency of ovary is there for lifelong. Even if you treat PCOS, it will occur again and again. So there is no a permanent remedy or a sure remedy for the PCOS. So we have to interpret PCOS in the dosha dhatu mala siddhanta. Next. Yeah, so the resembling conditions in the classics are Pushpagni Revati. Very similar condition is mentioned in Pushpagni Revati, that is a woman who observes her fruitless menstruation in appropriate time has fleshy and hairy cheeks. She is also seized with Pushpagni Revati. This is a very similar condition like PCOS mentioned in our granthas. Even PCOS patients comes to our OPD not as a PCOS, but most of the time as a Solia and as a Vandyatva. Solia or as a Vandyatva. So we have to correlate when you are treating a case. So if patient is come with infertility, you have to go through the infertility criteria, infertility treatment, and select a proper treatment. Similarly, in Solia, recently we wrote one thesis on the pathogenesis, similarity of pathogenesis of Solia and PCOS, and we found that almost 90% pathogenesis of Solia and PCOS is same. Next. So here is very famous quote that physiology we will understand first, that is vaya ahoratri bhuktanam te anta madhyadika kramat. So we will apply this what is told by our granthakaras, that vaya ahoratra and bhukta, they are ते अंत मध्याधिका क्रमात. At the end there is vata, at the initial phase there is kapha, and in the middle phase there is pitta. So we will apply this sutra to menstrual cycle and to ovarian cycle. Next. See, Rutakala, that is proliferative phase, is governed by kapha, that is Adikal. The first part of menstrual cycle, that is Rutukal, it is governed by proliferative phase, it is governed by kapha dosha. Then Rutavetit Kal, where there is an increase in the size of endometrial cells, that is secretory phase, it is governed by Pitta. And Rajak Kal, that is menstrual flow, that is throwing the endometrium outside the womb, it is governed by Vata dosha. The next slide. Here I put a diagrammatic presentation. See why this is important to understand days wise, because if you want to treat, for example, dysmenorrhea. So if you want to treat dysmenorrhea or pain during menstrual cycle, then you have to start treatment before the Vatakala, so that the patient will get released. So day wise medicines can be given in when you treat a PCOD, when you treat dysmenorrhea, when you treat amenorrhea, when you treat various kinds of menstrual disorder. So these three, the cycle, if you remember the cycle and dosha governance, then it become very easy to treat a gynecological disorder. Next slide. So ovarian cycle is also, this is physiology. If you understand physiology, then it is very easy to understand the pathology of polycystic ovary. So what is the physiology of ovarian cycle? There are three phases in the ovarian cycle. That is growth of the follicle, maturation of the follicle, and rupture of the follicle. The growth of the follicle is governed by the kapha dosha. Maturation, that is thinning of the outer layer and complete size up to 22 to 23 mm, is achieved in the presence of pitta. And the rupture, the last 48 hours, the rupture is governed by the vata dosha. Next slide. So this is again a diagrammatic representation. Kapha dosha is responsible for the growth of the follicle. Pitta dosha is responsible for the maturation of the follicle, and vata dosha is responsible for the rupture of the follicle. Next. See, this is again related to the various hormones. Next. Why I am saying this? What is my clinical experience? Why I am very much strongly convinced that this is the physiological condition. See, for example, when we send patient for the follicular study and we find that there is no rupture of the follicle, then only for 24 hours to balance the vata, because vata is responsible for the rupture. So we give vacha, asana, mohari for the patient to rupture the follicle, because they are balancing the vata. Then if you want to improve the maturation of the follicle, we use manjishta. Again, manjishta is useful in the pitta dosha, and ashwagandha for the formation of endometrial thickness. And then lastly, Lagumalini Vasanta to correct the LPD. So this is my clinical experience. That's why I'm very much strongly convinced that. Don't change the slide, please. Previous slide.
Okay, ma'am.
Yeah, and the last one is Lagumalini Vasanta. Lagumalini Vasanta is used to correct the luteal phase defect. We wrote one thesis also on this, that luteal phase defect and use of Lagumalini Vasanta to, yes, Lagumalini was, slides are not there.
Yeah, just a minute, ma'am. Again sharing.
Yeah. So we all know that Lagumalini Vasanta contains zinc, and zinc is very much useful for the implantation. So if you use Lagumalini Vasanta, there will be good implantation. So these are few of my clinical experience which strongly suggest me that the previous slides where I have explained the physiology is very much correlates with the Vayoratri Bhuktanam for the uterine cycle and for the ovarian cycle. Next slide. Next slide.
Yes, ma'am. Yes, I have changed. It may take few seconds, ma'am, due to network issue.
Okay.
Yeah.
So if you understand the ovarian cycle, the dosha dikya or dosha dominance in ovarian cycle and uterine cycle, it is very easy to treat various kind of gynecological disorders, because nowadays we are getting the disorders which are not similarly mentioned in our granthas. Very few are directly similar to the present diagnosis. So if you understand the physiology, it will be very easy for you to treat the various gynecological disorders. Here we are talking only about polycystic ovary. See how many patients you are going to get in future for in your clinics. The prevalence in India is up to 22.5% of the population. 22.5% means every fifth lady will be will be having polycystic ovary at some stage of her life. So this is very important, because lifestyle is changing and we are changing according to the century. So there is very much prevalence in women. Next slide. Now, how you will diagnose the PCOS? Because patient will not come to will come to your clinic with these complaints, that is irregular periods, having few menstrual periods, or having periods that are not regular are common signs of PCOS. Means patient will visit your clinic with irregular menstrual cycle. So how many what is the regular menstrual cycle? 28 days to 30 to 35 days cycle or 40 up to maximum up to 45 cycles. They 45 days cycle, they are considered as a regular cycle. So other than that is irregular cycle, or sometimes it is also called as irregular cycles. But we will not think about regular or irregular. Just grossly you can remember that there should be 9 menstrual cycles per year to any lady. So that is the normal pattern. So irregular cycle means sometimes it comes 28 days, the cycle will come on 28 days or 45 days or 3 months or 4 months, like that. So that they are called as irregular cycles. So too much androgens, high levels of hormone androgen may result in excess facial and body hair. So she will develop facial hair. Actually that photo I saw, I kept in the third slide. So facial hair, then hair become thin. The regular hair of the lady become thin, and facial hairs, but the facial hairs are thick like a mane. So these are two changes can be observed. Then polycystic ovaries in the sonography report. Some patient will come to you that weight gain is there. So when you send that patient for sonography, you find that polycystic ovary. So weight gain is very much closely related to polycystic ovarian disease. Then thinning of the hair, oily skin and acne. So diagnosis, these symptoms should be there. Then you can diagnose that patient as a polycystic ovary. Next. According to the Rotterdam consensus, polycystic ovarian syndrome is defined by the presence of two of the three of the following criteria. One, oligoanovulation. Oligoanovulation means scanty menses or less than 9 menstrual cycle per year. Regularly irregular or irregular menstrual cycle. So oligoanovulation. So ovulation is not there. That's why there is no withdrawal bleeding. Anovulation is there, because of that there is less progesterone level and androgen increases, and that is called as oligo-ovulation. There is no ovulation in the ovary. Then hyperandrogenism. Hyperandrogenism means hirsutism is the sign of hyperandrogen. Androgens they gets increased, so hyperandrogenic condition is there. And polycystic ovary, this is very important to remember, that more than or equal to 12 follicles measuring 2 to 9 mm in diameter, or an ovarian volume 10 ml in at least one cycle. So this is very important to understand that out of these three, at least two symptoms should be there according to Rotterdam consensus. Next. Now, what are the causes? Causes, they are very important. Why causes are important? When you are treating a case of polycystic ovarian disease, you have to take family history. Now, what family history is there? That her mother or her sibling, her sister or her atya, means bua, they aunt, they may have irregular menstrual cycle. They may not be diagnosed as a polycystic ovarian disease, but in family history, you will definitely get irregular menstrual cycle for her mother or sister or auntie. So like that, family history is very strong. And because of family history, we get around 9% of adolescent girls who are having polycystic ovarian disease. That is also very high. 9% of adolescent girls, means what is the cause? At the age of 13 she is having polycystic ovary. Thin girl, no any obesity, but she is having polycystic ovary. So family history is very important to take in the patients. So if family history is there, then you have to think the treatment like panchakarma. I will explain you in next few slides. Then obesity cause. Obesity also can lead into polycystic ovary. Like they goes hand in hand. Polycystic ovary is with obesity most of the time. Almost 85 to 90% patient, they are having obese polycystic ovary, and only 15 to 20% girls or ladies, they are having lean obesity. So obese PCOS and lean PCOS, but obesity is very much related to the polycystic ovary. Even insulin resistance and type 2 diabetes. Next. Now, what is the available treatment? Treatment is lowering blood sugar level, restoration of fertility, treatment for hirsutism, restoration of regular menses, and prevention of endometrial hyperplasia and endometrial cancer. Most of the time people think that okay, चलता है, irregular menstrual cycle है, क्या होता है, नहीं ट्रीटमेंट लिया तो भी चलेगा, हम सिर्फ एक्सरसाइज करेंगे, हम देखेंगे, वेट करेंगे, लेकिन ट्रीटमेंट नहीं देंगे. But you must convince to your patient that if she is having polycystic ovary at early age, she is the candidate who can develop endometrial cancer. So polycystic ovary should be treated even if the patient is of 13 years or is of 45 years. In both the conditions, polycystic ovary should be treated immediately for the prevention of endometrial carcinoma. Even restoration of fertility means if couple is married, they come to your clinic with infertility, you found that they are the lady is having polycystic ovary, then don't ask them to plan for the don't ask them to take OC pills and other to avoid the pregnancy. You ask them to have pregnancy immediately as early as possible. So this is restoration of fertility. Then treatment for hirsutism. So androgen supplementation जो दिया जाता है, that is treatment for hirsutism. But again, that treatment causes ovarian shutdown. So there is no, I already told you that there is no specific or definitive treatment for polycystic ovary in allopathy also. Not in Ayurveda, we have to try various things for treating the patient. Similarly, they also try various things to treat the patient. Next slide. Now, here we will see how the doshas are reversing. So, uterine dosha dushti, we have already seen that Rutukal is governed by Kapha dosha. Rutavetit Kal is governed by Pitta dosha. And Rajak Kal, that is menstrual flow, is governed by Vata dosha. Now, what happens? During proliferative phase, instead of Kapha dosha, Vata dosha increases. If the Vata dosha is increased, then there is dryness in the endometrium. So endometrium become very thin. Again, the kapha dosha instead of pitta dosha during secretory phase, kapha dosha comes. Even during rajakala, instead of vata dosha, kapha dosha comes. So this is a vata pradhana kafanubandhi dushti according to me. Sometimes people say that kapha pradhan vatanubandhi, but still everyone is agreed that there is kapha vata dushti. So that is concluding remark. Next slide. Previous slide, please. Yes. So because of vata kapha dushti, the menstrual cycles become few menstrual cycles, less than nine menstrual cycles per year, irregular, then absence of menstrual cycle. Because of shaitya of kapha, or the kapha dosha will not increase the size of endometrium. It will remain same. So there is delayed menses because of kapha dosha. Next slide. Yes. Then what is happening in the ovary? The growth of follicle is governed by the kapha dosha. Instead of kapha dosha, the growth of follicle during that phase, vata dosha is there. So what vata will do? Vata will bring more immature follicles, not single but more multiple immature follicles on the surface of the ovary. Now why this is happening? You have to explain this to the patient every time. क्या होता है? When the fetus, female fetus is in fetal life, during that life, during the 5th month of the pregnancy, there are around 5 lakh immature ovas in the ovary. The 5 lakh immature ovas in the ovary, they form at the when the fetal life, the fetus, female fetus is in fetal life, in the 5th month it is decided. Now what happens after menstrual cycle and when ovulation start at the age of 16-17, one single ovum comes on the surface of the ovary and it gets mature and rupture. Instead of that, not a single but around 12 immature ovas, they come on the surface of the ovary. So that is polycystic ovary. Now this will, as there are 5 lakh immature ova in the ovary, there are more chances to get the condition, this condition again and again. Even if you treat the patient and after treating 3 months, 4 months, 5 months, you find that the ovulation is there. There is only single ovum that is coming on the surface, getting matured and ruptured. But after 5-6 months, it remains like that. But after 5-6 months, again polycystic ovary starts, because the ovary has tendency to expel more than around 12 eggs on the surface of the ovary. See, the ovary is the adhishtan of teja. Ovary agneya, artavam agneyam. So ovary is the adhishtan of teja. There is no pitta in the ovary, and because of that there are multiple formation of cysts. So जब हमारे पास पेशेंट आता है तो हमने उनको ये बात बताना बहुत जरूरी होता है कि इसको कोई डेफिनेटिव ट्रीटमेंट किसी भी पैथी में नहीं है, क्योंकि वहां पर 5 लाख इमेच्योर एग्स है और वो हर वक्त आपको सरफेस में आ जाएंगे, आपको पॉलीसिस्टिक ओवरी का पिक्चर दिखाएंगे. तो डॉक्टर बदलना ये पॉलीसिस्टिक ओवरी की ट्रीटमेंट नहीं है, तो कंसिस्टेंटली आपने उसको लाइफस्टाइल मॉडिफिकेशन करना, ये पॉलीसिस्टिक ओवरी की ट्रीटमेंट है. ये पेशेंट को बताना बहुत जरूरी होता है. नहीं तो हमारे पास 3 महीने ट्रीटमेंट लेता है पेशेंट, 3 महीने के बाद में उसको रेगुलर 3 महीने मेंसेस आती है, उसके बाद में पेशेंट चला जाता है दूसरे डॉक्टर के पास. सो दिस इज नॉट द रेमेडी टू चेंज द डॉक्टर, टू कीप the lifestyle proper, because this is, if you put polycystic ovary on the in internet, you will find that the first line is that this is a lifestyle disorder, or we are privileged. Ayurved people, they are privileged people because they have what is the what should be the lifestyle. हमारी दिनचर्या है, ऋतुचर्या है, निशाचर्या है, रजस्वलाचर्या है, गर्भिणी परिचर्या है, उसके बाद में सूतिका परिचर्या है. ओनली आयुर्वेद के जो लोग हैं उन्हीं के पास क्या प्रॉपर लाइफस्टाइल है वो है, बाकी किसी पैथी के पास ये नहीं है। तो आपने सिर्फ उसको प्रॉपरली ऋतुकालचर्या, ऋताव्यतीत कालचर्या, उसके बाद में पुंसवन विधि में उसमें जो चर्या बताया है वो चर्या, ये अगर आप प्रॉपरली उनको बताते हैं तो पॉलिसिस्टिक ओवरी बहुत अच्छी तरह से मेंटेन होके उनके साइकिल्स रेगुलर हो सकते हैं। सो दिस इज वेरी इंपॉर्टेंट that you must understand why cysts are there. Cysts are there because there are immature eggs in the ovary, and they will every month almost 3 to 1 to 2 lakh eggs gets wasted, and only one egg come on the surface. So this is very interesting. So this is vata kapha dushti avastha. Next slide. Now what we have seen, what is the situation of dosha in the polycystic ovary. Now what is the situation of what we different dhatus in this. See, if rasa rakta dushti is there, you find the patient that is having only ovulation and menstrual disorder. That means patient comes to your OPD, irregular menstrual cycle है, लेकिन patient in her LHFSH ratio, there is no reverse of LHFSH ratio. Thyroid function is normal, then estrogen is normal, serum androgen is normal, only ovulation and menstrual disorders. That anovulatory cycles are there, little bit irregular menstrual cycles are there, and your sonography report is showing polycystic ovary, but other hormonal abnormality is not there. That at that phase, rasa and rakta dushti is there, and that is also sthanik rasa rakta dushti is there. So you have, if patient comes in this phase, then it is very easy to treat the patient. But if patient comes with obesity, then it become little bit difficult to treat polycystic ovary, because rasa, rakta, maunsa, medo, all 4 dhatus are out of 7. 4 dhatus are involved in the samprapti, that is disease process. When patient starts hair fall, thinning of the hair, then growth of hair on the cheek, then asti dhatu is involved. Again, fifth dhatu gets involved when there is hair fall, when hair fall starts, because hair fall never starts right from the beginning. It starts little bit late. Even hirsutism is the late sign of the polycystic ovary. Now, when patient comes with acne, oily skin, and anovulatory cycles, with obesity, with polycystic ovaries, and along with luteinizing hormone and follicle stimulating hormone reverse ratio. The LHFSH ratio should be 1:2. It becomes 2:1 when the samprapti goes further till majja dhatu, majja doshti. And at the last, there are other Oja Dushti also and Shukra Dushti, where depression, infertility, repeated fetal loss is observed in those patients. Next. Now, what is disease advancement? So, local vitiation of dosha, kapha and vata, then that is polycystic ovary, only polycystic ovary. When the polycystic ovarian syndrome is there, disease is there, dusha, all saptadhatu, vitiation of rasa and artho, all saptadhatu gets involved. And when polycystic ovarian syndrome, then rasa, rakta, maus, meda, asti, majja, shukra, all oja and shukra dhatu, all gets involved. So this is the disease advancement. So if the patient comes in the first stage, it is easy, that is sukhasadhya avastha. I will not call it as a vyadhi, because according to me it is a condition. Then condition goes into disease and disease goes into syndrome. Next slide. Now what is pathogenesis? When deranged vata and excess kapha vitiates rasa rakta maunsa meda asti shukra, circular and raised and knotted inflammatory swelling called granthi are produced in the ovary. So this is the pathogenesis. Next. Vata vitiation, kapha vitiation, which leads to, because why vata viseshan is the first is at the first stage, because Charka says nahi vata drute yoni vyapada. This is a kind of yoni vyapad. So vata viseshan, it will start with vata dominance, the area is of vata dominance. Then because of that vata viseshan then leads to kapha viseshan, then reproductive organs affected, then pitta decreased, vata obstruction, rasadi vitiation and sukradushti vitiation, which leads into PCOS and PCOD. Next. Now, what is the diagnostic criteria? Prakruti, we have observed that kapha pradhan prakruti women more prone to develop PCOD. Even vata prakriti, they are also very prone to develop lean PCOD. Vata prakriti people will come with you lean PCOD, and obesity, kapha pradhan prakriti people will come with you with obese PCOD. This is my observation in my day-to-day clinical practice. Then nadi parikshan vata kapha pradhan, and on the vata kapha pradhan nadi, rasa, asti and majja can be observed on the vata kapha pradhan nadi. Then raja parikshan, this is raja, blackish colored non-washable stains, this is the raja parikshan. Next. Now, what are the challenge as Ayurved gynecologist we are facing when we treat a polycystic ovary? Modern science people, they use repeatedly oral contraceptives for restoring the menstrual cycle, and according to us it causes pitta rakta vitiation. So as a Ayurvedic gynecologist, we have to neutralize the side effects whatever treatment she has taken before for fertility, for regular of menstrual cycle, and we have to actually treat those things first and then neutralize the side effects and then start your treatment. So oral contraceptives, we get the history of repeated use of oral contraceptives. So pitta rakta vitiation is there. So if she is taking oral contraceptives frequently for regulation of her menstrual cycle, you have to concentrate on pitta and rakta. So you have to start with panchakarma virechan in those patients who gave you the history of repeated use of oral contraception. Then ovarian stimulation like clomiphene citrate, HCG, HMG, taxomethine. Here shukra and oja vitiation is there. So here you have to use gruhan basti to correct the ovarian stimulations or to nullify the side effects of the ovarian stimulation. Now in anti-diabetic patient, the patients who are on anti-diabetic, so metformin is commonly used to treat the polycystic ovarian disease. So here you have to start your treatment with Vaman Chikitsa because Kapha Pitta Mutra Kleda Dushti is there. So you have to start your treatment with Pachan, Kapha Pachan, Vaman, and then start your oral medication. Without Panchakarma help, no one can treat polycystic ovary only on any medication. Actually, this is my clinical experience. Your gurus are there, they may have different clinical experience, but this is my clinical experience. Then they use anti-androgens. They causes vata, rasa and mutra dushti. So here you have to start with basti chikitsa. So these are the explanation, these are the common things we come across, and we have to face the challenges of side effects of the gynecologists to treat the side effects first. Next. Now, challenges to face as Ayurveda gynecologist: prevention of fetal loss and uneventful motherhood. So, if it is well established that polycystic, if a patient conceived having history of polycystic ovary, there are almost 40% chances of first trimester fetal loss. So, first trimester abortion. So, we have that challenge that if you treat a polycystic ovary and then patient conceive, then she needs drug like Garbhapal Ras, Laghumalini Vasanta to continue the pregnancy. Otherwise, first trimester fetal loss chances are there. So you have to give, if you have a patient, you treated a patient with PCOD and she conceived, don't leave her as it is for the gynecologist. Just start her Garbhapal Ras, Madhumalini Vasanta, or Masonomasequa till at least 12 weeks, because there are 40% chances. So this is one of the challenge is in front of us. In spite of giving progesterone and HCG, there are chances of 40% fetal loss. So this is very important, that don't leave the patient after treating polycystic ovary. Ask her to take at least Garbhapal Ras, Madhumalini Vasanta or these three drugs till 12 weeks of pregnancy. Next slide. So very important treatment for polycystic ovary, that is assurance, because there is no any permanent cure for the polycystic ovary, not in any pathies. It is a condition because I explained you that 5 lakh eggs, immature eggs are inside the ovary. We cannot, what is AMH, that is whether the eggs are there or not. So 5 lakh eggs are there waiting to come in the on the surface of the ovary. So assurance that changing the doctor is not the remedy for polycystic ovary, but correct your lifestyle and maintain it till, means for whole life. I used to tell my patient that you have to, if you don't want polycystic ovary, maintain the lifestyle for your whole life. Next. Now, this slide is very important, that how we can treat the patient. So potential interventions, what are the potential interventions? We come across with two kinds of patients, unmarried patient with polycystic ovary, married patient with polycystic ovary. Unmarried patient, if less than 16 years of age, then just advise diet, lifestyle modification. At the age of 16 years, diet, lifestyle modification and internal medicines and basti for more than 16 years in unmarried patients. Now, if the patient is married and infertile, then here we have to give actively diet, lifestyle modification. Along with that, very important is that Pachan, Shodhan, Virechan followed with Vaman. And then internal medication maybe I will come across in next few slides, but this is the summary, that Abhyantar Chikitsa but followed with Panchakarma. So this is very important. And if patient is not willing for pregnancy, say for example 40 years of age, then it is not necessary to give actively any management. So Uttarvasti surgery means ovarian drilling. So for that also there are some criteria. I am going to explain you in next few slides. Pachan, Shodhan, Virechan. In not willing for fertility, then start with Virechan and internal medication. Next slide. Now what is the diet? You can take the photo of these slides for all students. Ask her to add this in her diet. Asafoetida, that is 2 gram with both meals. Then sesame seeds, 5 grams per twice a day. So 2.5 gram in the morning, 2.5 gram in the afternoon. Water of curd, that is mastu, 20 ml both. This is my experienced yogas. So you can practice it, or you can add in your, you can ask the patient to add in her diet. Water of curd, that is mastu, 20 ml with both the meals. Then fennel, that is balan shepa, 5 grams a day. Garlic 8 to 10 medium size, both meals. Then Chandrashur, that is 5 gram once a day. Turmeric, that is Rajni Amla. So this is my clinical experience I am sharing with you. I have treated only with diet unmarried girls, 121 girls, sorry, in married women, 121 women, 29 conceived only with diet. It is a significant. They were not willing. They tried everything, Ayurveda, allopathy, everything. Only this diet, 29 patients conceived, reduced regular menstrual cycle in 68 patients, ovulation in 65 patients, and ovarian volume reduced in 34 patients. So this is a data I kept for only for diet, but it is, if you see the outcome, it is significantly effective. Next. So if I know that you are UG students or you are not going to go for the PG gynec, but still intrauterine growth retardation is also very common in the polycystic ovarian disease treated cases, conceived cases. So Shatavari Yashtimadu Amla can be given during pregnancy. Next slide. Yeah, lifestyle change. Only Ayurveda has this knowledge that what should be the lifestyle. So Rajaswalacharya advise proper Rajaswalacharya, do and don'ts during pregnancy. So what is Rajaswalacharya? Have you seen any ad on the in the TV that playing badminton using pads during menstrual cycle? This is very wrong according to Ayurveda. So I used to tell my patients that this ad is not for pads but for polycystic ovarian disease, because vata vitiation is there, and because of that again she will land into polycystic ovarian disease. So advise you your own study Rajaswalacharya and advise Rajaswalacharya for the polycystic ovarian patient, ovarian disease patient. Next. Now American inventor businessman, he says that the doctor of the future will no longer treat the human frame with drugs, but rather will cure and prevent disease with nutrition. That is lifestyle modification. Next. Now herbs. These are the herbs can be used. Next slide. These are the herbs which can be used. That is Lata Karanja, Putki, Amalaki, Haridra, Karela, Nimba, Gudmar, Kumari, Kanchanar, and Vijay. I did 6 theses on polycystic ovarian disease, and where I have used Lata Karanja, which is very much effective. Then I have used Haridra, that is also very much effective. Kanchanar is also very much effective. Kumari is also very much effective. So you can use these drugs for the treating the polycystic ovary. Next. So Lata Karanja is anti-diabetic, anti-estrogenic, anti-inflammatory, antioxidant, and anti-proliferative. So Lata Karanja is very much useful in polycystic ovarian disease. Single drug, you can use single drug in your practice because it is anti-diabetic, anti-estrogenic, anti-inflammatory. So anti-diabetic means insulin resistance will go. Anti-estrogenic means the estrogen level reduce the androgen levels. Then antioxidant, anti-proliferative. Then Kanchanar, anti-cancer, because they are very prone to develop in future cancer. So anti-cancer, antioxidant, hypolipidemic, anti-inflammatory, immunomodulating. Next. Kumari, aloe vera, that is anti-diabetic, hypolipid, anti-inflammatory, and induces ovulation. So all these are researches are there on Kumari, that is it induce ovulation also. Next. So what are the benefits of herbal treatment? Benefits of herbal treatment is multitasking action. For example, Lata Karanja, clomiphene citrate-like action, anti-estrogenic, anti-diabetic, anti-inflammatory, antioxidant, anti-proliferative. So our drugs take care of everything. Not only the clomiphene citrate will take care of ovulation. It will not take care of diabetes. It will not take care of inflammation. It will not be antioxidant. So our drugs are multitasking action. Next. So these are the few actually treatment I am using in my day-to-day practice. That is Pachan with Chitrakadivati followed with Basti. So these are the Basti for premenstrual 10-day Basti, or post-menstrual from 5th day to next 7 days Basti can be given. So this is, and followed with Kanchanar Gugur. So Chitrakadivati for the Prachan, then Basti Chikitsa followed with Kanchanar Gugur. This is quite effective in lean and both stula, medium, not a stolya, but the in mild Solia is there and lean patient, this protocol is very effective. Next. After using this protocol, it is observed that 13% patient gets normal menstrual cycle, then 23% they gets ovarian reduced ovarian volume, and in 63 patient the polycystic appearance of the ovary goes. So it is effective in normal in these three symptoms of polycystic ovary. Next. This is second protocol I use in my practice, that is Rashunadivati for the Pachan, followed with Basti and oral medication Arogyavardhini for 3 months. Next. In this patient, in this the second protocol, 54 patients we enrolled, 11 patients conceived, 21 patients had good ovulation. Then in 33 patient ovarian volume was reduced. In 39 patient, at least for 3 months they were having regular menstrual cycle. Next. Now in Uttar Basti, I am using Uttar Basti, but I have not found any means good effects for polycystic ovaries. So, but people used to give Uttar Basti, and that is called as intrauterine instillation. Next. So, Agni Karma, that is cauterization. American architect Buckminster Fuller says that you never change things by fighting at the existing reality. To change something, build a new model that makes the existing model absolute. Here I want to convey a message that don't think that the cauterization is not effective, as this is kapha vata vataja vyadhi. Cautery means agni karma will definitely improve this. So if it is difficult for you to treat the patient, ask the patient to go for the agni karma, that is cauterization. Next. Now what is the conclusion? It is a vata kapha dushti avastha. All dosha dhatu are involved in this disease. So it is kashta sadhya vyadhi. Pachan paschat shodhan plays important role before medication. It is very useful in its treatment. Few herbal preparations like Arogyavardhini, Maidor Gugul, Chitrakadivati, Kanchanar Gugul are useful, and single herbs like Lata Karanja, Haridra, Amalaki are useful. Next. So thank you. If you have any questions, you can ask me.
Yes, thank you very much, ma'am, for a truly enlightening and very knowledgeful session. And you have beautifully explained the correlation with doshas, challenges faced by Ayurveda gynecologist, and the possible potential interventions. Thanks a lot, ma'am, for a very wonderful session. Now it's time for question and answer session. If anybody is having any question, they can please ask. They can unmute your mic or can have hand raise. Any questions? If anybody is having any question, they can raise hands as well. Akhila V. Dr. Akhila V. Dr. Akhila.
Ma'am.
Yeah. Yeah, you can ask.
Thank you for your nice presentation.
Hello. Dr.
Can
Akhila.
you hear me?
Yes, you can ask.
Yeah. We have seen some cases with hyperprolactinemia and hypothyroidism in PCO associated with. How can we manage? Hello?
See, if hyperprolactinemia is there, you have to give Virachan, followed with that I use Kirat Tiktakvat
Kirada Tiktakwada.
in hyperprolactinemia, and in the hypothyroidism start with Nasya.
Nasya.
Shadbindu Nasya. Start with Shadbindu Nasya, and with that use Laghu Malini Vasanta.
Okay. Thank you, ma'am.
Now students want ready-made answers.
Ready-made.
But I like to give you, because if you see the results, you will be more happy to see the results after these treatments. So all the students, they want ready-made answers, and I like to give that.
Ma'am, so Kirada Tikta actually Pittahara. So hyperprolactinemia means we suspect that condition.
Yes, absolutely. See the lakshana of hyperprolactinemia.
Actually, associated with PCOS, some mixed symptoms only. So actually confused. We get sometimes confused with that. That's yeah.
Even you
Okay,
do
thank
prolactin level before treatment and after 3 months of kriyatikta.
Okay.
You will see the results, so that you will have the records.
Okay. Thank you, ma'am.
Okay. Next question is by Dr. Anoksha.
Yes, ma'am.
Yeah. Dr. Anoksha, please ask.
Good afternoon, ma'am.
Yes. Good afternoon.
Ma'am, please elaborate your experience about Uttarbasti use in PCOD patients.
Actually, PCOD patients, I don't recommend Uttarbasti. So I don't have any experience about PCOD and PCOS. But many gynecologists, Ayurvedic gynecologists, they use Uttarbasti in PCOD. But I don't use. When I use, when I treat the PCOD and patient gets the history of first trimester abortion, then for improve the implantation, I use Uttarbasti in PCOD patient. Did you get my point?
Yes, ma'am. Thank you.
Yes, thank you.
Any more questions from the viewers? They can raise their hands as well, or can please ask. Please unmute your mic and ask. Any more questions? This is a very interesting topic, and you can ask the questions, as it is a very burning thing, and ever rising prevalence is
burning
there.
issue nowadays.
Yeah.
Hello, madam.
Yes, please.
Yes.
I am Dr. Krishnaya, Arya Guru. You said that in regulation and.
No, your voice is not clear.
Okay.
Sir, please increase the volume of your device.
Madam, it is full. My volume is full.
Yeah.
Okay.
Talk loudly, sir. A bit loud.
Madam, you said Laghumalini Vasantarasam in menstrual regulation in the cycle somewhere, and in recent question of Akila also you suggested Laghumalini Vasantarasam. And is it a classical reference, or just your experience, or how is it effective in this menstrual abnormalities?
No, I don't understand your question. Please repeat.
Is it, my voice is clear or not, madam?
Yes, your voice is clear, but your question, it is not clear to me.
See,
what you want to know about Laghumalini Vasanta?
What I mean to say, how the Laghumalini Vasantarasam is effective.
Is used in
you said while describing about the PCOD, somewhere you mentioned about the use of Laghumalini Vasantarasam.
No, not in the PCOD. What I told you, that why I am very much strongly think that this is the correlation of dosha and ovarian and menstrual cycle, because when I use Laghumalini Vasanta, it improves the rasadhatu and endometrium, that is artha is upadhatu of the rasadhatu. So if it is effective on the rasadhatu, it will improve the endometrium of the uterus. Is it clear?
It's clear. I mean to say whether it is really indicated in a description of Sri Roga, or it is based on only dosha dhatu vijnana. I mean to say, because
it is Definitely based on the dosha dhatu vijnana.
So that's what I wanted to know.
Yes, yes.
So why you did select only that Lagumalini Vasantarasam? There must be some other effective drugs which improves the response.
Sir, I am sharing my clinical experience with you. So whatever clinical experience I have, I'm not using all drugs. I'm using few drugs which are effective. So that I shared with you.
Okay. Okay. Thank you,
Okay,
madam.
sir. Thank you.
Yes. Any more questions from the viewers? You can raise your hands as well. This is a very interesting topic, I guess. And ma'am has given a very detailed discussion on it. So if any questions are there, you can ask.
Madam, can you, I would like to congratulate you for a very nice presentation. I sincerely liked it. But would you like to talk on the hetus or the change of lifestyle which has caused this? Since we are getting so many patients of PCOD, so what is exactly the change in lifestyle which has occurred in the recent years?
Actually, whatever lifestyle is mentioned in Ayurveda, that is Dinacharya, Rutucharya. So opposite to all those lifestyle all these are hetus. So Brahme Muhurte Uttishtet. So what will be the hetu if the person is not getting up early in the morning? So that is the hetu of PCOD. So why to explain hetus one by one? So if lifestyle disorder, so lifestyle we know as Ayurvedic people we know the ideal lifestyle. So opposite to the ideal lifestyle, they are the hetus of PCOD.
No,
This is my understanding.
I want to know that PCOD, we are finding it very common last 10 years or 15 years.
Your voice is not clear.
Ma'am, please talk loudly.
PCOD, we are getting last 10 to 15 years in great numbers. Recently, in the last 5 years, we are getting even more. So the lifestyle has been changed over so many years. But PCOD cases are more now. We have to think over the problem.
Yes,
I think,
absolutely. That's why I took this. But stress is major problem which causes PCOD. Stress.
yes.
Stress of education, stress of your job. See, previously the women were there; they are not working. Now almost 100% women they are working. They have stress of their home. They have stress of their job. They have stress of growing up their children. A lot of stress is there. So it is not like that PCOD occurs only in the adolescent stage or in the fertile age. The PCOD is common in late age also. After 35 also it is common. Now the family completion is there. They have 2 child or 3 child. The family completion is there, but still we find the women at the age of 35 she is having PCOS. Why? Because of stress factor.
Okay. No, I thought that we have to elaborate more and we have to think more. What are the lifestyle changes in the last 10 to 15 years? I mean, some drastic
Absolutely.
have occurred.
Absolutely. They see the IT people they are increasing. See the PCOD we find in most of the working women also, housewives also, because stress is there. I asked them one thing I missed. I asked them to do meditation also with the treatment. That is very important.
Oh, good, very good.
Thank you, ma'am. Any more questions? Yeah. Hello. Any questions from the viewers, or they can share their views as well?
Yeah, even they can call me or send me mail. My number is WhatsApp number. So if they want to discuss any case, they can contact me on phone also.
Okay, sure, ma'am. Any more questions from the viewers? Any doubts? Okay. I think we are done with the questions for today, ma'am. Thank you very much, ma'am,
Oh.
for a highly informative session. And it was really knowledge-filled. And we are very much pretty sure that our students have been benefited a lot with your detailed deliberation, ma'am. And they will follow this kind of intervention and will succeed in their career as well. Thank you so much. And now for a formal vote of thanks, I would like to invite Dr. Meenakshi Jaiswal, ma'am. Dr. Meenakshi, ma'am. Dr. Meenakshi, ma'am.
Thank you, Poonam ma'am. Very good afternoon and Vinamra Pranam to everyone. It's an honor for me to have an opportunity to propose a vote of thanks on the 112th webinar of Gyan Ganga, a voyage of knowledge, a webinar series organized by Rashtriya Ayurveda Vidyapeeth. On behalf of organizing committee, I want to express my gratitude to our respected and renowned speaker, Dr. Swati Mohite ma'am, for her knowledgeable explanation on the topic potential Ayurvedic interventions in PCOS. Thank you so much, ma'am, for enlightening us with your detailed discussion on this topic. I would like to thank wholeheartedly respected Padma Bhushan Vaidya Sri Devendra Trigunaji, President, Governing Body RAV, for his blessings and continuous encouragement. I express my humble thanks to Vaidya Manoj Nesi sir, Advisor Ayurveda, Ministry of Ayush, for providing us his immense support and guidance. We are highly obliged to you, sir. I extend my heartfelt gratitude to Dr. Kaustubh Upadhyay sir, Advisor Ayurveda, also holding charge as Director RAV, for his constant guidance and motivation. I thank him for his valuable contribution and encouragement in all our efforts. I offer my sincere acknowledgement to the organizing team of RAV and the volunteers who work behind the scene for their tremendous effort to make this webinar series a great success. I am also grateful to all the respected Gurujans and participants who are connecting with us continuously throughout the series in spite of their busy schedule. Thank you so much to you all. I would like to inform that the topic and speaker for the next webinar will be shared with you very soon. Thank you all and have a nice day. Jai.
Yes. Thank you very much, ma'am. Thank you.
Thanks a lot.
Thank you for
Thank
being
you.
with us today. Yeah. Thanks, ma'am.
Thank you.
Thank you.